Hello everyone, and welcome to the Mental Health Commission of Canada's webinar series on integrating psychological health and safety in the workplace. Today's webinar topic is building a psychologically healthy workplace. My name is Tina Quarry, and I am the Program Manager on the Workplace team with the Mental Health Commission of Canada, and I have the pleasure of being your host for today's webinar. Just before we start, I wanted to go through a few housekeeping items. In order for us to have some dialogue and exchange at the conclusion of our presentation, I invite you to send any questions or comments using the chat feature, which can be found on the right-hand side of your screen. If it doesn't show up for you, look for the icon on the upper right-hand corner of your screen. It says chat. It looks like a little bubble. And you can click on that, and a chat window should appear for you on the right-hand side of the PowerPoint slides. We encourage you, when you're sending your questions, please send them to all panelists. Use the drop-down menu and select all panelists. So the questions can go to myself as well as the presenter, and I will ask the questions on your behalf. This webinar is also being recorded, and it will be posted on the Commission's website in the Webinar Archive section following the presentation in approximately 2 weeks. Also, due to the large number of participants today, we have muted all of your phone lines just to eliminate any background noise. We are delighted to have Bell Canada with us today, and before we start, I wanted to take a moment and congratulate Bell Let's Talk for its leadership and impact on Canadians' mental health. The Bell Let's Talk initiative has recently been extended for a further 5 years, and Bell has increased its commitment to Canadian mental health funding to at least $100 million. Bell has provided leadership on workplace mental health, and they have certainly led by example. So on that note, let's get the presentation started. It's my pleasure to introduce to you our speaker, Marie-Helene Favreau, who is the Director of Mental Health, Workplace Practices, and Disability Management with Bell Canada. Marie-Helene is also a dynamic leader with 25 years of experience in both the public and private sectors. She's recognized for her strategic leadership and business innovation capabilities applied in health safety and human resource capabilities. Marie-Helene joined Bell in 2014, where she is responsible for a broad portfolio of corporate centers of excellence composed of mental health, disability management, and workplace practices. In this capacity, she oversees a diverse team of health professionals and HR consultants. Thank you, Marie-Helene, for joining us, and I'm going to turn things over to you to get things started.
Hello, everyone. I'm really glad to be with you today. We have a lot of elements to cover. I will try to go maybe a little bit faster in the front end of the presentation to provide you an overview and context of the Bell Let's Talk initiatives within Bell to allow a bit more time to focus on the core elements, which are really the workplace programs and how we have leveraged the national standard to structure ourselves and leave some time for Q&A in the end. As I mentioned, I'm just trying to click the slides here. Okay. We're also going to spend a bit of time in the end to talk about the organizations in terms of resources and measurement. We try to build the content in line with a lot of requests that we get from organizations contacting us, so hopefully it can answer some of your concerns or questions regarding mental health initiatives. So we have been addressing mental health at Bell. We launched this wonderful initiative 5 years ago, and it really is built on 4 pillars: anti-stigma, care and access, research, and workplace health. So as it was mentioned, we're up to $73.6 million so far invested in mental health, but we are committed now to take this all the way up to $100 million, and we suspect it may get even further depending on the participation of the Bell Let's Talk initiative and anti-stigma media campaign. The anti-stigma campaign has been really increasing year over year. We could see that it actually created a great momentum. Last year, we became #1 Twitter topic for a little while on the Bell Let's Talk Day. It was quite impressive to see that we were getting that traction worldwide, and we're getting texts and calls and tweets from, really a lot of people, and that helps funding the Bell Let's Talk investments. So it's really exciting to see, how much this has taken off year over year, and we really are hoping that the next 5 years will continue on the same trend. In terms of care and access and research, just for people to understand that a good part of this money is injected in community organizations across the country from coast to coast to coast. A good number of organizations, some of them very small but very effective, where, we felt it was unacceptable for Canadians to be on a waiting list to get access to mental health care, which unfortunately is still the case, but we're trying to invest the money in organizations where we can actually speed up the access, and we do have measurement that some of the clinics, for example, youth clinics where people used to be on a waiting list for 6 months now have access within 6 weeks, for example. So we know that this money is really being used in the local communities, and it's helping a lot of Canadians. In terms of research, we are also hoping to accelerate the learning in terms of mental health. One example is the Douglas, the example you see on the left side of the chart. It's a brain bank. It's kind of weird, but the Douglas Hospital, we've invested $2 million as an example in this brain bank. They are hosting brains that are being used across the world. There's only a few facilities in the entire world that are equipped this way with the high-tech technology. We can send portions of brains to researchers in Sweden, in Norway, in Australia that are working on specific areas of the brain to try to resolve and understand a bit more of the root causes of some of the mental health diseases. So we're also trying to invest on that front so that we can get better at treating and preventing mental health diseases. Now, the big conversation today is really on workplace, because this is the one pillar where we are approached largely by organizations trying to understand how to kickstart mental health initiatives or continue to build on what they already are doing. So we're going to try to address some of that in the next few slides. Our workplace health initiatives are really aligned on two segments. A lot has been done on education and awareness, and I would say this is where we started in the beginning, and we're going to come back to that a bit later on. So we have employee events, mental health information on our intranet site. We have developed training for our leaders, but also adapted versions for union and joint committee members, and also for team members. But it's one thing to break the stigma and to educate, but once you do that, you can expect that you're going to have more people reaching out to seek care and support. And this is why the bottom portion is also to be coherent, is we need to make sure that we also offer some additional support systems for our employees that come forward and that have the courage to seek care and support. So we did a lot of promotion and enhancement of our employee family and assistance program. It used to be an employee assistance program. We've included the family members in that as an example, and also the broad brush services have been expanded year over year. We also invested more in our return to work program and how we can help people to come back and with success when they re-enter reintegrate work after sick leave. And we also enhance the benefits coverage for psychological care because typically the Employee Family and Assistance Program will be short-term counseling orientation, but for folks who need a longer-term psychotherapy or psychological support, they need also to have some sort of benefits coverage to at least pay a portion of the fees that come with that. So as you see, we've been working on the two fronts, really educate, aware, and then also offer the care and the support that our employees need. So we're going to spend a bit more time talking about the education and awareness topics. In terms of awareness or mental health campaigns, if you want, we have 3 per year. One is around the Bell Let's Talk Day, and it used to be a day, I'd say it's a couple weeks now, so we start typically a week before and lead into the formal Bell Let's Talk Day with workplace events. We have another touch point in the Mental Health Week in the beginning of May, and then one that's about to happen in early October next week with the Mental Illness Awareness Week. So we have these 3 formal touch points with employees every year, and we have been, diversifying the approach here. We started off with lunch and learns, and then we added seminars and webinars and web chats and short series, and one of the reasons why we've evolved and adapted these is to be able to reach out to our diverse population across Canada. Some of them are on very tight schedules. If you think of the call center operations that we have at Bell, it's very difficult for them to go off their call center for an hour for a lunch and learn. So we had to adapt our initiatives to try to branch out and reach, to a broader base of our employees. So we've been doing that year over year. So some of these discussions are with mental health experts. Some are, nutrition, wellness. We've also expanded a little bit the topics to be a bit more holistic. And you're going to see later on that one of the things that we do is we have systematic feedback from our employees that help us steer the topics in line with their own interests, so that we always try to answer the employee interests and needs in these events. In terms of training, there were big discussions a few years way back to when we started looking at breaking the stigma. One of the areas where we felt we would probably have the biggest impact was to work at the manager level, the people leaders, given that they do have an impact on an entire team, and that they would have to be educated and trained to make sure that they are conscious of their own personal bias and that their approach has an impact on employees that they may not even begin to realize. So we started working in a partnership with Queen's University and our EFAP provider to develop a training. It started by a classroom initial module, but now it's evolved to a 3-module curriculum that is developed in partnership with Queen's, and it's really also in alignment with the national standard to make sure that in the way we approach mental health in the workplace, that leaders are trained and they actually get to practice and build their skill set as part of these modules. And there's a generic version of that training that is available to employers, and we can answer that later, but just for you to know that it is something that is available to employers, and we know that at least probably 60 organizations right now, minimum, are using this training. Just to cover quickly the modules themselves, the first one is really an overview of mental health and introduction of effective management practices. We're up now to 8,000 leaders trained. It's quite impressive. That started in 2011 and up until today. So we have 8,000 leaders trained. It's now part of a systematic onboarding for new leaders. And then the Module 2 is really, you know, after laying out the foundation in Module 1 is let's get in practice some of the skills with case studies that we specifically built to reflect Bell's reality. And we get even executives, it was so funny to see them, and when we launched the Module 2, you know, to see the executives getting into the role play of one being the leader, the other one pretending to be the employee coming back or facing a mental health issue. But it really resonated well, and the feedback we're getting is very positive. That, you know, it's one thing to get the theory, but to put it in practice, all of a sudden they realize how delicate it is to interact with employees and how, you know, they need to get prepared before they have these delicate conversations with their employees. And the Module 3 is really focused on work environment, prevention levers, how to sustain a positive and create a positive work environment. The modules 1 and 2 are mandatory at Bell for all people leaders. So we're often asked, how did you get 8,000 people? Well, we had a very solid push from our CEO, George Cope. You know, the entire Bell Let's Talk initiative is his baby. He's got a personal vested interest in mental health, and he's been very, very engaged and tracks participation. So, you know, it makes our job easy to try to deploy the training. But you're going to see later on that we still, you know, sometimes have challenges in that we will share with you. So this is the training in 3 modules. In total, it's around 11.5 hours that individuals need to spend. And in the end, the nice thing is they get a wonderful Queen's University certificate to testify that they took this leadership mental health training. We think it's the only training in the world that has this length and depth of skill set training for mental health. So we're very proud of that. You know, the return to work, as I mentioned, was a big element. You know, in the delivery of the mental health training with the leaders, it systematically came up that, you know, they find it very difficult when they have to, an employee comes back, they have to address the team, and even sometimes when even before they're off work, or to prevent them from going off work is this notion of accommodation also of mental health limitations or challenges in the workplace. So one of the things that we have done is made sure that we had support for employees and for leaders for difficult cases that are coming back to work. So we have a multidisciplinary team that meets and that prepares the return to work. It could be a group with the union representative can be there, the employee, of course, the manager, the HR counselor. Sometimes we even have the case manager, of course, of our insurance carrier is also involved, and sometimes we even have a mediator, an external mediator that can jump in to try to find the best approach and the best solutions to bring the employee back to work safely, progressively, respectfully. But we know how critical this is because if we leave people off work for too long, the longer they stay out of work, the harder it is for them to come back. And after 6 months, 50% don't come back. After a year, you know, 80 to 90% never come back. So we have a window in the first few months to, as soon as they start getting better, to look at what are the work barriers, what can we do to remove them. And these are very interesting discussions because as you probably live in your own organizations, leaders sometimes have a tendency to say, well, I want to make sure my employees 100% before they come back to work, but that doesn't work that way. If we want them to get back to 100%, well, they need to come back to work slowly and progressively, and that's part of their rehabilitation into work. So this is a big effort that we've put out, and we also have structured our disability case management with mental health professionals during the disability as well to give additional support to our team members. So it's a structured approach to return to work. In terms of the national standards, so, you know, we gave you quick highlights of like the core elements of the programs, which have been employee campaigns or mental health campaigns, employee events, education of our leaders. You know, I didn't get in the details there, but we also have a revised version of union leadership training that we're giving to the union. And actually, recently they've asked us to take the entire scope of the leadership training, and we've accepted to get them through the 11 hours of training as union leaders. And then, you know, as we were building these initiatives, we were looking for a framework to go beyond that. And the national standard, you know, we were part of the group that helped frame and develop this standard, but we were hoping to take it to the next level internally and really apply it. So the next section is, you know, over and above the training and the mental health campaigns, what we've been doing, you know, in approaching and using the standard. So, you know, we started off, as I said, with awareness and training. We've also mapped the services and the programs that we have already internally at Bell. And then we seeked employee feedback. We did focus group at the time a few years ago, and we continue to gather employee feedback. You're going to see that later. We did a lot of focus groups in the beginning to understand that where the gaps were between what we had and what we have even today and what we would like to develop eventually, and also looked at the workplace risks. And I'm going to give you examples later on of what we mean by that. And then we started off slowly by having a short-term plan and then the mid to long-term plan. I think one of the questions we often get is, you know, how can we tackle this, and we can't do everything at once, and we have limited budget and limited resources, and where do we start and how do we go about this? And frankly, it has to be step by step. There's no way we can tackle the 13 factors at once that are embedded in the national standard, and there's no way an organization can do what we have been building over the past 5 years and deploy that within a year. So it's really, it's a journey when you start, you know, deploying a mental health initiative. So we started doing our short-term plan and initiative, mid to long-term. As we go along, we also ensure that we built in employee feedback loops or mechanisms so that we continuously improve what we're doing and that we gather their feedback and make sure that our perspective is based on the needs of our workforce rather than an expert view or, you know, a small group viewpoint, that we try to make sure that it's built from employee feedback. And then what we started doing and still are doing is embedding some of the best practices into our HR processes, because the vision at one point would be that we wouldn't have to call this a mental health initiative, that it would be fully embedded in our processes, and that's the vision, to make this sustainable over time, that it doesn't stay as a standalone initiative, that is fully embedded. So, so this is basically a little bit of the recipe, and I hate saying that because it's not really a recipe, and every organization has to approach this, but this is how we did it at Bell. So, you know, one of the elements is, as I mentioned, is identifying starting points and quick wins. And as we were preparing for this discussion today, we were looking at, you know, what are the typical quick wins, things that may be early, easier to deploy, and of course employee events or campaigns are something that can be organized. Lunch and Learns, many organizations already do some of these initiatives on other topics. Mental health training, using material that is already available can also be an approach that a lot of organizations have started to do. Employee and family assistance program and promotion is, many organizations have EAP services and programs. They also have insurance carrier often dealing with their disability. These organizations and third party can help organizations in their journey. They have resources and they have connections and they have expertise often that organizations don't have internally. So, it would be sad not to leverage these as well. And internally, depending on the organizations, there's typically some employee networks or social committees or health and safety committees that are already in place. And that is also a way to kickstart some of the initiatives and get some momentum around mental health. But the idea is to find what works best in every organization, depending on the DNA. Some organizations are very data-driven. Some organizations are more employee-focused driven, or and the approach needs to be tailored. But at least it's easier if you start with some processes that are already in place, for sure. The channels to capture the employee feedback. So once you start building a little bit of momentum or events or initiatives, what we have found was very useful to gather the feedback, as I said, and we do this in a couple ways. So we thought it could be interesting for you to see how we go about looking at employee feedback. So, for example, in the top corner, the mental health event surveys is every time we have a webinar, a lunch and learn, a web chat, a seminar, we seek for employee feedback with a survey. And, we ask questions as, was it a good use of your time? Do you think you can apply the learning in your personal action plan or in your personal day-to-day? And we leave an open space to what would be your preferred topics for the next events. And then we analyze all the data afterwards, and then we feel that we're better equipped for the next time around, to adapt and modulate according to the employee feedback. So that's one example. What you see below is a similar example of mental health training. So every time there's a training that's being organized, even online training, there's systematic survey going to participants. And then there again, there's a few questions that are being asked, and this is a real example of an answer that we got after the Module 2 training and with the executives, that before the session and after the session, you could see the difference, how they felt better equipped after the training. So it's a way for us also to go back and say, what we're investing in this training is really paying off. And so we're also building credibility in our initiatives with our senior people when we have this data to go back and to showcase how the initiatives, are having an impact, a positive impact. We have employee surveys at Bell, and I know there are some mental health surveys also available, mental health at work surveys, or we have our Bell Team survey, and many organizations also have employee surveys. We have them on a yearly basis at Bell, and what we have done in the past few years, and this year we changed the survey providers, and the questions also changed. We did an exercise of mapping the questions, and you're going to see that in a future slide, to try to align some of the questions with the national standard mental health factors. And you're going to find, if you do that exercise, that, you know, often surveys do have some questions that touch on recognition, on respect, and these are key elements of the national standard. So even without creating a new survey, leveraging existing surveys is also another avenue to capture employee feedback. And then we have the joint labor committees, where we share on a quarterly basis with our union representatives our mental health initiatives, our upcoming events. You know, we try to get their feedback also on what they see as pain points in the organization that would not be aligned with our mental health initiative, and then we analyze their feedback and we go back and we try to continuously improve our processes internally with this joint labor committee feedback also, which is very useful. And the other great thing with this is that, you know, our union representatives, you know, by being engaged in this process, they actually become ambassadors when we have employee events or campaigns that they actually help us promote, and we partner with them to promote some of these initiatives. And they have a huge appetite for training, and so it should be a win-win discussion with joint labor committees, and that's what we have found, that, you know, we can make this into something that's meaningful for everyone. Then, so capturing, you know, starting to deploy events, initiatives, evolving these according to employee feedback, but then you also need to act on the feedback. So here's an example of, you know, we have had feedback from our employees that we have so much information, they have a hard time finding, you know, the critical information on how to get in touch with the proper services. And, you know, even with the new generation that we see with them, that they are a bit less reading in the intranet, they're more in the apps world with their iPhones, and so we are using some applications, and online group therapy, for example, is something that we are piloting right now with some of our employees. So we are constantly trying to evolve the services and make it easier for the employees to get to the support services that they need. Another example is the community support, the peer support groups. We have had some requests, and we were actually preparing, planning initially to launch a peer support group initiative internally to Bell. We had some roadblocks operationally to do that, but we were creative and found another way to answer the needs regarding peer support. And what we're doing now is, through the help of our employee family and assistance provider, that we have identified community peer support groups. It's actually a great thing, because some of them are really specialized in, let's say, eating disorders or bipolar diseases, or, you know, whatever the topic or the need is. And our EFAP provider can steer our employees toward these resources that are specialized. So here's an example of, you know, we had the feedback, we had the need, and we are trying to evolve the services to answer that. The next few slides is just quick examples of how we embed. When I say embed in HR processes, what do I mean? So here's an example that any employee joining Bell goes through an onboarding process. We had the code of conduct, so we integrated the mental health policy into the code of conduct and into the onboarding of new employees, and we also dedicate some time in the onboarding to go through the mental health policies and programs at Bell, so that from day one, when the employee joins Bell, that they already know where to get support and resources, and also that they understand the culture they're getting in, and that they behave accordingly. So we felt that was critical to embed some of the mental health information and best practices right into the onboarding. Another example that I touched upon was the survey. So in the new survey that we had this year, we had 28 questions. We mapped all these questions with the national standard factors, and we identified 19 questions that are related to the national standard, and we decided to focus on 4 key questions that would be foundational, because we felt 19 questions, you know, it's probably too much information for business units to digest, but we decided that we would focus on the 4 key questions that touch on health and safety protection, psychological protection and support, civility and respect, and recognition. And well, the great news is that when we benchmark the results on these questions versus national norms, we see that we're slightly above the norm, so that's a feel-good moment for Bell. But then we also analyzed all the verbatim in the employee survey. We did queries for mental health keywords, so stress, mental health, workload, work life. So we've done a full analysis of the verbatim on the survey, and now we've developed a corporate action plan that is not specific to mental health. So as part of the corporate action planning, there is a section where we touch on a few mental health elements, such as work life, for example, or recognition, and so now that's embedded in the employee survey action planning. So another example of using an existing HR process and weaving in some mental health components into the existing process, not creating something on a standalone necessarily, but really infiltrating and contaminating the processes in a positive way with some mental health elements. And here are a few more examples of, you know, other HR processes where we have added some mental health elements. Performance management. So every year we had, you know, an increase in disability, an increase in complaints after the year-end performance reviews. Employees were saying, and I saw that actually in my previous organization at Pratt Canada, employees were feeling that they did not get feedback throughout the year and that they would get hit at the end of the year with some, you know, sometimes not so constructive feedback, but negative feedback. So we did a couple things. More and more organizations like Bell, now we have a mid-year review so that it's not, you know, we have, you know, more frequent feedback. And of course, it could be even more than just mid-year and year-end. But at least we have 2 formal touch points, the mid-year and the year-end. And we also included in the mental health training of the leaders how to approach a declining performance when you suspect there's a mental health, there could be a mental health piece. And then we train our leaders on how to address performance issues, but in a supportive way. So that's been included in the mental health training. And we also have a leader's guide on our intranet specifically on declining performance and, you know, the best approach. So that's one example of an HR process where we added some elements. I talked about the mental health accommodations earlier. Harassment bullying is another recent example. As we were reviewing our process to investigate harassment complaints, we have added mental health safeguards because there again, that was identified as a workplace risk because we had a high level of disability during harassment investigations, and we understood the process of investigating a complaint is very stressful. So, for example, now we systematically offer EFAP support right from the beginning of the HR investigation process. We have a mental health checklist that we give to the investigator so that they, if they see that there's any vulnerability of the complainant or the respondent during the process, they refer them to our mental health team and to EFAP. And so we really have been trying to infiltrate, again, that process to make it safer and less stressful on employees right from the beginning. One of the simple elements also was a quick introduction to what is going to happen in terms of the complaint process and setting the expectations. One of the feedback the employees was that they didn't realize in the beginning the process would be so lengthy and so difficult, and so we manage expectations up front and we give them support right from the beginning. So that's another example. In terms of getting organized and resources, do we need an army of people? That's another question that we often get by organizations. You know, we have, of course, our CEO sponsorship. We're privileged at Bell with George Koch being so involved, and we also have Mary Deakin, who's our, you know, mental health initiative chair. But beyond them, I mean, it's a team of 3 people, and so it's not like we have an army of people and we do this for 57,000 employees. But the fun thing is we have some strategic partners like communications, community investment, and we also leverage health and safety, the entire human resources and labor relations team, our disability management team. We also have the help of finance when it's time to create a business case. We've used our internal audit team to help us audit ourselves against the national standard elements, as an example. And we do have passionate employees and union representatives. So the message here is it's not that difficult to get people involved in mental health initiatives. You know, employees are really proud. We actually get spontaneous requests from employees that say, I want to get involved. I would like to help out when you do campaigns. So, you know, it seems like it's not that difficult to get momentum, you know, when you leverage a positive spin around mental health. So that's never been a problem for us. And then the other key element here is external resources and partnerships. There are some mental health experts and partners, you know, public organizations, your insurance carrier, EFAP providers. There's free information and resources on the Bell Let's Talk site, and we have links to the Canadian Mental Health Commission, to CAMH Foundation, a lot of organizations. The Great West Life site also has great information that is free, and that, you know, so organizations should not be shy of you know, looking and seeking for free resources that are available already. So in terms of measurement, so we often get asked about resources, and then typically the next question is, okay, but if we want to build a business case, how do we get structured and what kind of measures do we need? And not all organizations have access to the same data, but, you know, one thing that's easy, and I spoke to that earlier, is when doing events, having a survey and capturing the participation rate and then the feedback is, you know, something that's easy to put in place. The next evolution of that is going to targeted KPIs. So we decided a few years back that the 2 main KPIs that we would focus on would be the improvement in the utilization of our employee and family assistance program. We more than doubled it over the past 5 years. And you know, people got scared at the beginning that the cost would go up, but now it's so fun to see the language. Everybody sees this now as an investment because it has been an enabler to reduce the number of short-term disability claims, which is the second KPI, where we've seen a decrease, double-digit decrease of short-term disability claims related to mental health. And it's not because our headcount has gone down. Our headcount has gone up, and even with the headcount growing, we have less mental health short-term disability claims. So these are the 2 KPIs that we track and that we, you know, really proud because we see the results now after a few years that are really impressive. And then, of course, Bell being Bell, everything is around metrics and KPIs, and so we have over 90, which is not something I would suggest to start with, but we got a bit crazy and excited with KPIs, and now we have a scorecard that we track on a quarterly basis and with over 90 KPIs. This is quite impressive and quite a lot of work, but it's paying off because we have all kinds of data points that we can measure and help us to steer our initiatives. So key takeaways, when some of the realizations that we got is the more we promote and talk about mental health, the more we open ourselves to critics and cynicism. So one of the recommendations here is, make sure there's some form of organization to answer complaints or to look at employee feedback, because if we want to walk the talk, then when employees are saying, yeah, right, Belle, let's talk, blah, 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 we need to be ready to do our work and go and look at their specific situation and see if we missed out on any processes or, on anything, and if we need to improve our process. So, we try to be really responsive, and we typically give an answer back to employees within 24, 48 hours. So that's our commitment. Raised expectations, of course. If we promote and showcase mental health best practices, employees will expect more of their leaders, for example, and so that's also part of the reason why we trained our leaders, because we knew that employees would have raised expectations. Leveraging the standard we have found was helpful to try to get a structure, and the nice thing about the standard is the flexibility that it gives in terms of maybe some organizations have, out of the 13 factors, they can already see that they're working on a few of them, and then they can connect the dots and start building data and KPIs with what they have and then expand to the other factors. So it's not something that is rigid. It's a backbone framework that is useful, and it really helps if you try to get your thoughts going on where to focus your energies and look at what you have already, which is useful. And then, of course, the measurement and the implementation piece. Well, you can imagine with 57,000 employees, some of them being in very remote areas of Canada, there's no way we deploy programs across the board all the time. So, we typically start in a small business unit or in one location or in one province, and then we expand. And then we did that a couple times, and it was really helpful to tweak, what our initiatives. So, and training, for example, before we issued it to the executives and the leaders, we piloted the content with our HR community and with a few other folks before we would launch it at large. So we have that approach of piloting and testing before rollout. And in the KPI, I think there needs to be a balance of hard data, like financials and the cost of disability, for example, but it also there has to be a people side to the KPIs, and businesses that, if they go in this only to save money, we think is not the right approach. So, I think, we are proving now with our own results that it's a good business investment, but it also has to be done with the faith that it has a very positive influence on people. And so, we try to balance the hard data KPIs with some of the employee engagement KPIs, because we want to be careful about, even the perception of doing this for saving money is not the right perception. So we want to make sure that in selecting the KPIs that we are balanced, and then we measure and adapt. So that's how we go about it, and we're not over yet. We are about to launch a new health risk assessment questionnaire in 2016, in early 2016. So we will gather some mental health and physical health components there. It's going to be tied to our benefits renewal, and employees will get an additional benefits coverage if they participate in this health risk assessment questionnaire. So that's going to be fun. So it's a new thing that we're launching in 2016. And then, of course, we're going to continue to strengthen the initiatives that we have in place right now. And part of our fun is to share our approach, but also learn from other organizations about what they're doing. And I think today is a good example of, you know, we're really open to feedback or comments, and I think we're going to open up to questions at this point.
Thank you so much, Marie-Helene. That was just so much information. I know that our audience has been sending us lots of questions, very attentive. Well, I just wanted to start off, there's been a number of questions about the Mental Health Leadership Certificate Program. Can you just again, perhaps repeat some of the details if people are interested in that training, how to go about accessing, is there a cost, do you need specific tools and resources in order to take that training?
Yes, and the prime contact, so the license for that training has been given to Morneau Shepell. So, you know, organizations that are interested should contact Shepell, and maybe we could provide them with the contacts at Shepell after the webinar so that they can reach out to them. And the cost may vary depending on the size of the organization, the number of sessions, and so on. So I don't, you know, I can't comment on the cost piece, but I know some organizations, you know, and they're pretty open to customizing. So for example, some organizations may be using only Module 1, you know, you don't necessarily have to go through the whole curriculum. So I would strongly invite participants to reach out to Morneau Shepell to get all the details.
Okay, and we'll make sure the link is updated in the presentation so our audience can have access to that. We also had another question again regarding this leadership program, asking about how the training has impacted those with mental health concerns in addition to those who have received the training, and we were talking about within your organization.
Yeah, okay. Teresa, did you want to comment?
Hi, everybody. My name is Teresa, and I have the pleasure of working on this initiative with Marie-Helene. And so some of the impacts that we're seeing, of course, you know, we have equipped leaders with the knowledge and the resources and the practical tools to support their employees, as well as, you know, in terms of reducing the stigma and creating a culture where we need our leaders to support our employees, as well as we want to encourage our employees to put their hand up and feel comfortable that they will be supported by their leaders. We're getting feedback from the unions also indicating that they're starting to see that shift. And because we're equally investing in the unions in health and safety, and they're also being trained, they're there to remind leaders of their roles and what they're being trained on in case they've not had practice, as well as they're reminding employees that they should be coming forward and should feel comfortable within the organization to tell their leaders that they're under pressure or they're having some issues at home and they might need some more flexibility. We just launched Module 2 in Q2 of this year. We have a lot of leaders still to go through it, but we are starting to see that shift, and we believe by next year we should be seeing some significant culture shift because of it.
Perfect. Thank you so much. We have another question regarding activities at Bell, and it's what employee events at Bell elicited a positive response from employees as you launched your mental health initiative. So was there something in particular that resonated with your employees? I know you're very busy doing lots of activities. Is there anything that stands out?
Well, one of the things, so for example, live testimonials, so people sharing their stories, that's always very popular. However, when we do our event analysis, it's funny because some of this is extremely popular, but maybe even more for women than men. Men are are registering more when there's an educational topic. So if we have a psychologist talking about anxiety, or if we have a psychiatrist talking about what is bipolar disease. So the educational piece, it seems to appeal more to men, and the live testimonials, that's funny. I don't want to create stereotypes here, but that's what our analysis is telling us. So, so we try to balance even in the topics to have a mix, so that we try to make sure that we have as much, male participation than women. Yeah.
And Marie-Helene, you mentioned, a few starting points and quick wins that one can do. We've got a number of folks in our audience that are new to this, how to get started, or smaller organizations that might not have a lot of resources. So can you just, again, what might be a couple of one or two tips for taking the tips for getting started?
Yeah. So again, depending on the organization, so for example, in organizations where health and safety is already part of the organization DNA, that's a good place to start. So if there's health and safety meetings or health and safety topics in some of their lunch and learns, or this is an easy or natural fit to start, including, so a lot of organizations have started wellness events or campaigns, so that's a natural fit to start injecting some mental health topics into that. So that's one example. Another example would be leadership training. So a lot of organizations, have some leadership training, onboarding. That's another natural fit to start looking at mental health education. Some organizations have employee committees doing social, for example, team building activities. Well, that could be one place to start volunteering in a mental health organization in the community. So, I mean, we can get very creative depending on what makes the organization tick, or, what are the practices locally that are being normally used. Yeah.
Thanks so much. We've got a question around disabilities. I know this is a large topic, but do you have any suggestions? The question was asked, how do you evaluate or assess employee disabilities, and do you have any existing solutions? So again, I know that's a big subject, and it depends on what the issue is, but do you have any suggestions?
Okay, so I think there's a mix of things here. Like what we have been trying to do is early detection and intervention. So, before they get to a disability status. And this is why one of our KPI was the promotion and utilization of our employee assistance program, so that early on employees would reach out. So that's the piece before they get on disability. Once they are on disability, well, we haven't made major changes to the disability process itself, but it's not so much in the what, it's in the how we manage disabilities. So the fact that we've added mental health specialists as case managers for mental health diagnosis, so the employees that goes off on short-term disability at Bell, if the primary diagnosis is something on the mental health side, they will be assigned to a disability case manager that has mental health expertise. So that's one example of a change that we made, but the process itself, that they fall after X number of days on disability, they need to have their papers filled by their physician. The process itself is still the same, but we've added components in there to support them better and to hopefully have early identification so that, you know, they may still go off on disability, but if they haven't waited for so long, they have a higher chance of coming back to work more easily.
Perfect. Thank you so much again. That's been very, very helpful. I just wanted to mention to our audience that we've got more resources, and on the slide here, if you want more information about Bell Let's Talk Toolkit and a few of their other resources so that you can help and join in the conversation about mental health. I will make sure the link to the Workplace Mental Health Leadership Certificate Program is up to date, and also the link to the national standard and its accompanying guide assembling the pieces. So that is also available. The standard and the guide is available free to download. I just wanted to also mention that our next webinar will be on October 28th, and you can hear about the Mental Health Commission's case study project, where we're following 40 organizations, and we're going to learn how they are actually using the standard. And just as a reminder, this presentation, as well as all of our presentations, will be on our archived webinar page, so you'll have access to the presentation as well as the PDF as well. And we just wanted to say thank you again, and if you would take a moment and please fill out our customer satisfaction survey that's going to pop up on the screen as soon as we exit from the webinar. So again, thank you again on behalf of all of us for joining us. You have Bell Canada's contact information as well as ours. You can certainly contact them if we weren't unable to answer your question, or if you would like more information from them as well. So again, thank you again for joining us, and we do hope we'll see you next month. Bye.